Hi, I'd like to introduce all of you to Dr. Howard Tenenbaum, a professor in the Department of Periodontology at the University of Toronto and a highly respected dentist in the Toronto community. And he'd like to share with us his thoughts about the PeriActive product, which he's been using for a number of years. Dr. Tenenbaum, perhaps you can just elaborate a little bit more on your background and your position in the periodontal world.
Well, thanks for having me. And I've been at the university since 1984 after finishing postdoctoral studies at NIH, Ph.D. and DDS and specialty at the U of T a few years before then. And my area of research has predominantly been in the area of bone cell biology, but then I started to branch out into other areas of interest relating more to periodontal inflammation and periodontal disease and bone loss and so on. And I ran a very active, very busy practice alongside my teaching career at the university and research career at the university. My practice was periodontics, and in the sense, the types of patients that I saw were very challenging. They were referred from other specialists in many cases, other periodontists. And of course, I had a regular periodontal practice where people, routinely refer general dentists and so on. So I really was able to see a wide spectrum of patients who suffered from various presentations of not only periodontal disease, periodontitis, gingivitis, and mucosal diseases, and so on. There's a heavy emphasis on pathology as well.
So how long have you been using in your practice or in the patients in university the PeriActive rinse?
Well, more or less since it was introduced. In fact, before it was introduced, because I found out about it somehow. Maybe through a publication of yours, or I'm not quite sure. But I remember emailing and trying to find out if we can get a handle on it. And I would say it's at least been for the past 10 years. We started to use PeriActive rinse, in particular for another problem, by the way, which was peri-implant disease, which was occupying more and more of my practice time, almost more than patients with periodontitis, oddly enough. So we really needed to understand the disease more, which is basically a disease of inflammation and infection. But we needed to attack the inflammatory end of disease, which was, I think, something that was sorely lacking in the field of periodontology until the advent of certain therapeutics. And I would put PeriActive in that area. So it had or has antimicrobial properties, very important, as you know, in the practice of periodontics, at least in use in vivo in the patients. But it also had something that I consider to be even more important, which was its ability to inhibit inflammation. Because at the end of the day, periodontitis is a disease of inflammation. It's triggered by bacteria, it's exacerbated by bacteria, and clearly when we remove the bacteria, the disease can resolve to a large degree, but we also know that it is a disease of inflammation, and we need to be treating it as a disease of inflammation. So PeriActive became really fundamentally important in that regard, and I must say that even the patient experience with PeriActive was very positive.
So would you say that with the unique aspect of the PeriActive would be it not only its antimicrobial effect, but also its ability to penetrate into the tissue and resolve inflammation and promote healing? And how important would you categorize that added benefit that it has over the other rinses?
Oh, well, it's almost, I can't use the word infinite, but certainly the value of PeriActive because of its dual functionality, its pleiotropism, is at least, if I was going to put a number on it, I would say it's 10 times better than anything else that I would use. I mean, you can get a certain result with an antimicrobial rinse like chlorhexidine, along with staining. And really, the clinical benefit